Hello, everyone.
This meeting is being recorded.
Hello, everyone. This is Dr. Siddharth Damber. Welcome to our webinar today. Today, we are talking about peptide therapy, the GLP-1 agonist for weight loss, specifically talking about some challenges, but we're going to talk in general about GLP-1 agonists, what's being offered, how they work, what's so special about them, and then some of the unique challenges that some patients have with these. In particular, in some cases where some patients may have difficulty continuing to lose weight despite being on a GLP-1 agonist. So, if you're on this call, you already know obesity is a big problem. The scope of the problem is massive. It's not only in the United States, it's global, it's worldwide. The sheer number of people who are dealing with obesity and all of the medical issues that come with it is absolutely exponential. It's absolutely dramatic. The health effects affect so many different things, musculoskeletal problems. I see that every day in lower backs and lower extremity issues, cardiovascular issues, metabolic issues like diabetes, insulin resistance, hypertension, even immunologic, higher rates of infections and higher rates of some autoimmune conditions like psoriasis, psoriatic arthritis. Some cancers can be at a higher risk as well. So we obviously need better solutions for weight loss because of all the problems that it causes and all the challenges that we see. So let's talk about how we can address this better. The typical limitations with the traditional model of weight loss are diet and exercise are essential, but they're difficult or not adequate for many people. And so what we realize is that weight loss and obesity it's a multimodality issue. There's biological issues, psychological issues, environmental issues. It's not as simple as eat less of one thing and it's handled. So you really have to handle this in all of its issues. So our goals of treatment should be to not only lose weight, right, but it should be to reduce body fat, improve body composition, optimize or maintain muscle mass, reduce visceral fat that is associated with metabolic and cardiovascular issues, improve your cardiovascular risk, improve your metabolic risk factors, improve your exercise capacity, your eating habits, and everything else that comes with that, immune and gut health, sleep and stress management. So there are 3 ways a diet can really help with weight loss. There's that you'll eat less total calories, and that really means if your intake is less than your output, then you'll have weight loss. You can eat less of specific foods, but which foods is sort of all over the map. Namely that some people, in the lay press or the lay population, you'll see some people who do everything from as extreme as vegan no oil, I know someone who does that, to some folks who are as extreme as fully carnivore only. And what you realize is that there's a lot of differences in terms of how people are made up, and there needs to be some consideration in that in terms of getting the best kind of result when it comes to what kind of food that you eat. So then the question is, well, what types of foods? And, honestly, it's not clear because there are differences between people. So what most medical societies will recommend is more of a Mediterranean diet, which is more balanced, less red meat, less refined sugars, more vegetables and lean meats. And then, of course, there's eating only during specific periods of time. Intermittent fasting is the classic one where you fast for 16 hours and eat for an 8-hour window. And the classic is starting to eat at 10 a.m., finishing eating at 6 p.m. I think there's a lot of sense to that, in the sense that if you can avoid eating too late at night, that's probably better for you. You don't want to keep that high blood sugar going on throughout the night. So a combination of all of these are the way that diet can help you out. Each one of them has some challenges. So let's talk about peptides. Peptides are naturally occurring molecules that act as signaling molecules in the body. That means is that they're proteins in your body that tell your cells what to do. So we can utilize peptides to emphasize the pathways in your body that are helpful and de-emphasize the pathways that are more problematic. It is definitely the future of medicine, and it's there are components of that are available right now, which is pretty exciting. So the GLP-1 agonists, let's talk about that. So stands for glucagon-like peptide 1. It's a naturally occurring gut hormone that regulates your appetite, your insulin secretion, and energy metabolism. There's a few other related targets to the GLP-1s, but GLP-1s are the main one. So they have a key role in your body's ability to regulate blood sugar and insulin secretion. Because of this, it has a very key role in diabetes. And as a treatment for diabetes, it's a really fantastic option. Turns out it also has a lot of other benefits when it comes to your metabolic health as well. So semaglutide is the generic name for GLP-1 analog that mimics the effects of natural GLP-1. Relatively low risk, incredibly good when it comes to not only controlling blood sugar and diabetes, but as it turns out, also promoting weight loss and improving your overall metabolic health. Again, it works by mimicking GLP-1. So it will help your body to shift blood sugar from your bloodstream into your muscles more efficiently. It helps your body slow down the transit of food that's going through your body, so you're not absorbing it as fast or really absorbing all of it, so that you're restricting how much your body's getting exposed to as well. And then it also reduces your appetite or that food chatter or hunger chatter. And it does that by reducing the neuropeptides, the gut telling your brain that, hey, you should be hungry. And it also increases the neuropeptides, your gut telling your brain that you should be satisfied. So works really remarkably well, and not only helps with weight loss and metabolic health, helps with so many other things, which we'll talk about. So semaglutide is a GLP-1 analog or agonist. Tirzepatide is another version, and we'll talk about the difference in a moment. Again, they work by controlling your appetite and weight through this connection between your brain and your gut. Slows down that progression of food through your system, slows down stomach emptying, so you're not feeling as hungry as often, reduces the hunger sensations that your body naturally gets because your gut is telling your brain, we should be hungry now. And it helps people feel fuller sooner. So when you are eating, you're not feeling like you need to keep on consuming food. It also helps to reduce food cravings, food preferences, and thoughts about food, which is very interesting because that is that's another problem. You can be eating less, but are you eating the right things? This helps you avoid eating the wrong things as well. So semaglutide and tirzepatide are both FDA approved for type 2 diabetes, and they're both approved for chronic weight management in adults. This can include for people of a BMI over 30. What's exciting, it also includes for people of a BMI over 27 who also have one other weight-related comorbid condition, one other weight-related problem. That can include high blood pressure, diabetes, cholesterol, osteoarthritis, fatty liver, pre-diabetes, if you're already prone to that, if your numbers are getting borderline. If you've got heartburn, if you've got polycystic ovarian disease, hypogonadism, or asthma. Other potential future indications. Can we utilize this to prevent heart disease? Can we use this to prevent pre-diabetes? Can we use this to prevent neurodegenerative diseases? Some interesting data coming out showing that GLP-1 agonists can be helpful in people that have neurodegenerative conditions like Alzheimer's. And it turns out there's a metabolic component to that. Can this be utilized as an anti-aging treatment as well? And can this be utilized in metabolic syndrome? So exciting, newer ideas that are still being studied and figured out. So the protocol for semaglutide and tirzepatide, you're basically injecting yourself, subcutaneous injection once per week. The keys are to start on a low dose and slowly escalate monthly as you need to. The reason why we do that is because it helps to prevent side effects. It also helps you prevent from reaching a level of tolerance to the medication too soon. We then monitor your weight, your appetite, and observe for any side effects on a monthly basis. I do recommend checking your metabolic health labs every 6 months, starting at baseline, then every 6 months after that to make sure it's working, to make sure that it is not causing any additional problems. So the results from clinical trials are very exciting. At the 1-year mark, semaglutide can give about a 15% weight loss on average. Tirzepatide can give about 20%. If you combine this with good nutrition and regular exercise, you'll get even better results and you'll stay healthier longer term. Safety profile in general, these treatments are lower risk. There's no such thing as no risk. The main side effect is GI stuff, meaning that you are affecting how your body is pushing through food through your system. So you may be more prone to some GI symptoms like nausea and constipation. There's other rare side effects that people have had. The keys in all these cases, when it comes to medical treatment, is follow with your physician on a regular basis, start on a low dose, then slowly go up. If you're having some side effects, you may need to have some adjustments made. We'll talk about what some of those could be. So there are some interesting challenges that could happen with GLP-1 treatments. Number one is intolerance with semaglutide. So that is probably the most common one. And by intolerance, I mean some nausea and GI disruption, right? Like just some nausea and maybe loose stools. There's a couple things you can do. Number one is you're going to adjust your dosing. So maybe you're on too high of a dose. Maybe you come down on the dose a little bit. We see that happen where someone's fine on a lower dose, and if you go too high, they're not quite right. So you kind of go somewhere in between. Another option, you can try different GLP-1 agonist. Tirzepatide tends to be a bit better tolerated from a GI standpoint. And so we generally start with semaglutide first. And if that's not working or tolerated, then moving on to tirzepatide. There's other weight loss options as well, lipotropics, which we'll talk about, other peptides, maybe we'll talk about that as well. What about if you're not losing enough weight with semaglutide? Occasionally we'll hear that. Either people have hit their limit in terms of where they're going, or they have some limitations on going to a higher dosage. So there's a few things that I would recommend. Number one is you have to maximize your exercise. By exercise, I mean a combination of both aerobic exercise, cardiovascular exercise for not only weight loss, but heart health as well. And then definitely also weight-bearing, weightlifting exercises. The reason why you need to do that is a few things. Number one, if you can build up your muscle, that helps with weight loss on its own. Number two, when you're losing weight, you're not only losing fat, but you can also lose muscle. Your body will sort of affect both. And so in order to maintain body composition, you need to do the right kind of exercises. So maximize exercise if you find you're not losing weight adequately with semaglutide. That can be, if you find that your workouts, you've kind of plateaued as you're doing them on your own, think about working with a trainer to push you a little bit further. I think that's always helpful. Then the next step is maximize nutrition. I think a lot of people assume they're eating properly, but maybe they're not. And sometimes if you're looking to lose weight, you may need to make certain changes to your diet that are different than what you're currently doing. So for example, you may need to do an elimination diet, right? Where you eliminate a whole bunch of foods that can typically cause metabolic issues and inflammation. And you may then start reintroducing some foods to see how well you respond. Or you may just need a little bit more education in terms of what are the right things to eat for your body, yourself, and what things you need to be careful with. I think working with a nutritionist or a dietitian is key in that regard, and we certainly recommend that regularly. And then you have to look at what about other medications that you're on? You may be on other medications that could be affecting your weight loss as well, or causing you to gain weight. For example, let's say you're on steroids for an autoimmune issue or chronic asthma or chronic skin issues. Well, that could be causing more water weight gain. That could be an issue. There's other medications that can sometimes cause water weight gain. You'll see folks who are taking medications like Cymbalta, which can be used for both depression, anxiety, as well as for pain from osteoarthritis. It can also cause weight gain. So are any of the other medications possibly causing an issue in your case? And then there is optimizing hormone health. Is your thyroid okay? If your thyroid is underactive, that can definitely cause weight gain. In addition, what about just your general hormone health? If you're a man, your testosterone. If you're a woman, your estrogen, progesterone, testosterone levels, like where do those stand? The reality is that as we age, we all have those kind of hormonal changes that occur, men and women. And if there's an avenue to optimize those, that can also help with weight loss as well. Not uncommon. I think anyone who reaches a certain age, you realize that what you used to eat, how you used to exercise, does not give you the same results or affect you quite the same way as when you were 10, 20, 30 years younger. And so sometimes you can make all the right exercise and nutrition changes. Maybe you need to also make some of the right augments when it comes to your hormone health as well. And then, of course, when it comes to if you're not losing enough weight with the dose of semaglutide that you're on, you just need to escalate your dose. I do find, paradoxically, I find that in some cases, patients have been pushed way too fast in terms of their dosing. Like every month, they're just going up on a dose, and very quickly they get side effects, or very quickly they reach a tolerance level, and they should be going much slower. But in other cases, I've seen people who are slowly going up on their dosing, and then they just stop midway and don't keep on going up, even though they're tolerating it. And so it's possible you may be hitting your limit with a GLP-1 agonist because your dose has not been optimized. Again, you can also try different GLP-1 agonists. Some people respond better to tirzepatide than semaglutide. Tirzepatide, on average, gives a little bit more weight loss than semaglutide. It may be that you need a different peptide treatment. And again, think about lipotropics, think about other peptides, and we'll talk about that. Lipotropics. These are substances that help in the breakdown and metabolism of fat in the body. It's a combination of various vitamins, supplements, and amino acids. The benefits are they can improve your energy level, good for liver detoxification. They can aid in weight loss. I don't think it's as strong as the peptides, the GLP-1 agonists, but it can aid in it. It can be helpful on its own in a milder degree. It can also aid what you're getting from the peptides as well. It can improve your cardiovascular health, improve your mental clarity, improve your hormone balance, boost immunity, and even improve some degree of joint health as well. So low risk option. It's given as an intramuscular injection. You inject yourself once per week. Combined with peptides can give a bit more weight loss. Health coaching. We work with dedicated provider and group that helps us out with weight loss and nutritional coaching. I think education in terms of what's the right way to do this for you, what's the right way to eat if you want weight loss, what's the right way you want to eat if you want anti-inflammatory effects, what's the right way you want to eat if you want an elimination diet. I think education is a key part of this. Accountability is key as well. You know, it's said that to create a new habit, it takes 60 to 90 days. So you have to stick with it. Interestingly, the peptides can help you stick with it. Accountability, it helps if you are accountable to somebody else. It sometimes pushes you over the line in terms of being able to achieve new habits and reach your goals if you're accountable to somebody else as well. So I think health coaching can be very useful here. Keys to optimized treatment, peptides plus minus lipotropics, have to do the exercise, have to do the nutrition, maximize your chance of weight loss. When it comes to nutrition, you want to eat nutrient-dense food and avoid overeating. And eat the right things, don't eat the wrong things. Exercise, as I mentioned, cardiovascular exercise to assist with weight loss and improve your metabolic health. Strength training to protect from muscle loss, improve your body composition as well. Newer peptides that are out there as well. There's a few different types of growth hormone peptides out there as well. They work in slightly different ways. They work slightly differently, but they all work on that axis in terms of improving metabolism and helping to burn fat, and in some cases, improving lean muscle mass as well. Maybe something to consider as well. Always think safety first. With the GLP-1 agonists, these are heavily studied and followed, meaning probably every month there's a new study on GLP-1 agonists. Case reports all the time. So relatively low risk, no such thing as no risk, but relatively low risk. The other peptides, the growth hormone peptides, not as well studied. So in general, most peptides are generally safe when used under medical supervision, all right? For the GLP-1 agonists, fairly straightforward. With the growth hormone agonists, there's some other potential things in that it can cause fluid retention, headaches, nausea, can sometimes increase your blood sugar. It's a different kind of treatment. Again, not quite as well studied as the GLP-1 agonist. So side effects can potentially happen with any treatment that you're taking, medical treatment you're taking. Your physician should be adequately trained and equipped to manage these kind of issues. All right. And if you can't get a hold of your physician, or you don't have ready access to your physician, or you don't meet with them very often, not ideal, right? Like the team needs to be able to manage your issues. Keys, as always, are start low on your dosage and slowly escalate as tolerated and as needed. Again, GLP-1 treatments, tons of evidence and published evidence. The growth hormone agonists, really not as much. There is positive physician experience for those treatments. Always be cautious if you have other medical issues. Your physician needs to know that to make sure you're being treated properly. Follow an experienced and knowledgeable physician, and understand that some treatments, at least the growth hormone ones, there are cycles where you're on these things. With the GLP-1 agonist, generally you're taking this long-term, regularly. Combining peptides is an interesting idea. Really little to no data on that, but it's probably where the future will be going, which should be interesting, where you are emphasizing the pathways you want, de-emphasizing the pathways you don't want. And again, for best results, healthy nutrition, regular exercise. Understand this is not a quick fix. Slow and steady wins a race. Always work with a physician who knows what they're doing. Your physician should be aware of the regulatory issues. What is FDA compliant and not? What is FDA approved and not? They should understand how compounding pharmacies work, because a lot of these treatments come through compounding pharmacies. The benefit of compounding pharmacies is you can get your treatment at a more cost-effective rate. You have less hassle when it comes to prior authorization. You're generally not as restricted when you have drug shortages, which can happen with the brand name versions. And compounding pharmacies, they have their own pluses and minuses, and your physician needs to understand this. And so, because this is an area of active regulatory stuff, your physician needs to be on top of the details and knows how to guide you here. If you're getting your GLP-1 agonist, your peptide, through a compounding pharmacy, there is the risk of always potentially losing your peptide therapy if the FDA comes down and says compounders cannot do this any longer. And that happens from time to time. Your options are that you can purchase a brand name versus the compounded version. It will be more expensive, but the brand name versions are coming down in price. The compounders have sort of instigated the brand name versions to come down in price. You may change to another peptide if your existing peptide is unavailable, or you may just be patient and it may just come back online with a little bit of time as well. But we've seen that happen as well. Some frequently asked questions. So, how long before you see weight loss with the GLP-1 agonist? You may notice a little bit of weight loss in the first month, but as we tell everyone, you have to give it at least 3 to 6 months. And it takes a few months to slowly build up your dosing and your tolerance. And so you have to give it a little bit of time. How much weight can you expect to lose? On average, the amount of weight to lose is 15 to 20% at the 1-year mark. How long you have to continue treatment? Again, there's your initial period, 6 months. The studies for the GLP-1 agonists show that these peptides are most effective for chronic weight management. And that means using treatment long-term. How long? Frankly, we don't see an end to it at this point. Do you need to eat healthy and exercise when using these treatments? Yes, it will help you get a more optimal result. Keep in mind that the GLP-1 agonists can help you eat healthier because you lose some of those cravings for food and you're not over-consuming. Can semaglutide and tirzepatide make your muscles and bones weaker? It's possible. If you lose weight, you lose both fat and muscle. So you have to focus on body composition in terms of weight and resistance training exercises to maintain your muscles. Optimize it with great nutrition to maximize your muscle and bone health. In the future, perhaps even combine it with other peptides. Now, the curious question I've heard is, I really don't eat too much. Will treatment help? yes, they can still actually help. They can help with your metabolic health. And lipotropics do not affect your hunger or how much you eat, and they can be beneficial on their own as well. Another interesting question. If you stop treatment, will you regain the weight? Studies show if you stop semaglutide, you'll regain 2/3 of your weight loss over time. The key is maintain good nutrition, and exercise is the key here if you want to maintain your weight loss. So should you use them long-term? Look, the data shows that you can maintain weight loss if you take these long-term. Safety data goes out a few years now, more than 2 years now. Maintenance dose, maybe lower in dose and frequency if needed as well. How do peptides compare to other prior weight loss medications? Look, they offer more effective weight loss, and they seem to be safer as well. So our comprehensive physician-assisted weight loss program here at Chicago Arthritis and Regenerative Medicine starts with a thorough evaluation. What's going on with you? What's your medical history? What are your goals? What are your other underlying health conditions? Safety first. Our program is run through our clinicians, physician assistants who are experts in these treatments, doing this safely, competently for you. Continuous monitoring and adjustment. Keys to be a good doctor, frankly, are to be a little bit obsessive when it comes to what's going on with your patients, to make sure that they're being taken care of safely and appropriately. Closely monitoring and making sure things are done properly. And then regular lab monitoring every 6 months to make sure everything is safe and being handled properly. To learn more, you can see our QR code there, or you can go to our website, chicagoarthritis.com, see the link for peptide therapy. Our pricing is up there. We also have a discount going on, our summer discount for 2025. That is still live and active. Okay, wonderful. Let me just pause to see if there's any other questions. Okay, great. No other questions. Well, listen, everyone, I appreciate everyone's time today. If you're interested in watching this after the fact, this will be on all our social sites. You'll also get this via email as well. And you can share this with family, friends, colleagues who you think might benefit from this. If you have questions, would like to learn more, check out our website at chicagoarthritis.com. Check out our social media sites. If you'd like to be evaluated, contact us via any of those sites as well. And until we connect again, I hope everyone stays healthy, stays well, and be well. Bye-bye.